What are nasal polyps? Okay, your nose is blocked. It's been getting more and more blocked every day. You can't smell. And then you go to your ENT and they tell ENT surgeon and they tell you have polyps and you're like, what is that? First, let me assure you, you're not dying. It's a benign condition. My name is Dr. Amada. I'm an ENT surgeon based in Abuja. So now let's go into what we call nasal polyps. Now, we have these spaces in the skull, some in the cheek, some in between the eyes, some in the forehead, and there's one deep inside. They're called sinuses. They all connect to the nose through small channels, okay? And then they have a kind of lining, just like what is in the nose. Now, this lining, when it's irritated for any reason, allergies, infections, inflammations, when it's irritated, it swells up. It gets filled with fluid because fluid goes there to try and wash away the irritant, the lining of the disease. If it keeps happening and they get very large, they now leave the sinuses in which they occur and fall into the nose. And as the irritation continues, they keep expanding and expanding until they become these big masses with many foots. That's why we say polyps, and they're inside your nose, okay? And as they grow, they do things. They block the airway, so you can't breathe. Some of you will now snore. They block the airway, so smells can't go up the nose and be perceived. They block the airway, and then in some cases, when they dry out and everything, they start to bleed. They can occur on one side of the nose or two sides of the nose. The commonest sinus they come from is the one called the ethmoid sinuses, which are the ones in between the eyes. So when they occur there, they can even make the face widen and push the eyes out and to the sides. So they can affect the way the person looks. And of course, if your nose is constantly blocked, it affects the way you talk. So your speech now starts to sound funny. What's the treatment? It can be either medical or surgical, but this will be determined by an ENT surgeon after they have seen you, assess the polyps to know the size, and then, if they are on one side or both sides, then the CT scans are done so that they can see whether it is limited the nose itself or what it has extended into, and if it's damaged anything around. And also, as I said, polyps are benign, but sometimes they can mimic more serious conditions. So the ENT surgeon has to see you first before they decide which kind of treatment to use. So if you're having any of these symptoms, you know what to do. See an ENT surgeon.